and I'm a student pharmacist. I'm going to go over how to set up a station to do a blood glucose as well as cholesterol check today. So first you want to make sure that you have the right paperwork. So we have the Operation Diabetes form that shows all of the ranges for the blood glucose levels. And then we also have the Student Alliance ledger where you're going to sign in and make sure that you tally each patient and each test that you do. So your workstation, you're going to want to make sure that you have everything set up. We have our cholesterol machine, our diabetes, our blood glucose machine. We have the strip. We will have a strip for the cholesterol machine as well. We have a lancet to draw blood. And then we have a capillary for the cholesterol machine. And then we also have an alcohol swab as well as a Band-Aid. We will have some hand sanitizer as well and gloves. So you want to make sure that first you use some hand sanitizer. You use it in front of the patient. So whenever a patient comes up to your station, you're just going to want to introduce yourself. Hi, my name is Amanda and I'm a student pharmacist. Is it okay if I check your blood glucose and cholesterol levels today?
Yes.
Great. Alright, so we're going to put our gloves on. And again, make sure that your equipment is ready. So we're going to turn on our glucose machine as well as our cholesterol machine. We're going to open our alcohol swab as well as our Band-Aid. And we're not going to open it all the way. We're going to make sure that the tabs on the inside are still intact. What you can do is remove one of them and place it on your glove like that so that it's easier to apply to the patient after you prick them. And you just ask the patient, is it okay if I go ahead and poke you on one of the fingers, because I do need to get some blood from your fingers. So what I'm going to do is actually ask her, is it okay if I massage your hand to get a little bit of blood flow going? Okay, great. So you want to massage, maybe even from the forearm down. And then kind of draw the blood to the bottom of the finger. Is there any particular finger that you would like for me to poke? Okay. Alright, so she asked me to do this one, and what you actually want to do is poke her on the side. So the best way to do this is to actually swab her. And then let it dry, because if you do poke them while it's wet, it is going to sting. So while it dries, what I usually do is get my lancet prepared. So you just want to twist the top all the way off. Okay. And make sure you have your sharps container by your side so that you can drop it into the sharps container after. So what I'm going to do is just put this on the side of her finger. And I usually just press down on the tip of her finger a little bit, on the little pad of her finger. And then I'm going to push it into the side of her finger. And then just give it a little press. So you're going to start to see, you're going to want to make sure that you put this in the sharp container and that you get your blood glucose strip ready in your machine. So you're going to see some blood come out, and you can continue to squeeze it because we're actually going to use the blood to do her glucose as well as her cholesterol. This comes up really fast for it to ask for blood, so you just scoop it up on the side here. You don't need to scoop it, you just need to touch it to the blood and it'll suck it up. And then you heard it beep, so it comes up really fast. As far as the cholesterol, what we do when we collect it is from the blue side of the capillary. It has some heparin on the end. The capillary itself will actually help the blood draw up. So you don't need to scoop it or anything like that, you just need to press it against the blood. And as you can see, the blood is just coming up and it's drawing up. So as you can see, you know, sometimes people don't bleed a lot, or you might think that you're not getting a lot of blood. So what you can do is you can actually put this down on your towel and ask her just to raise her hand below her heart. And then gravity will do the work as far as bringing the blood out. So you can massage your hand a little bit more. So you're going to collect the blood all the way up past the blue part. Put this down, and I would suggest at this time to put the Band-Aid on the patient. So you can take your Band-Aid, put it on her. What you're going to do is take the plunger, stick it into the black end, and then push the blood through the capillary. You have to push just a little bit, not too hard though. And you would push it onto whenever you insert the strip into the cholesterol machine. And then you want to make sure that you dispose of anything that has blood on it, like the capillary into the sharps container, as well as the test strip into the sharps container. And then you can put your machines aside, get the rest of your supplies, fold it up, and take your gloves off. And now you're ready to counsel the patient. After we take the cholesterol and blood glucose readings, we have two different sheets as we've shown you before. Typically they would have already had their blood pressure taken, and then our cholesterol measurements are going to be on the bottom of that sheet as well. You want to make sure that you write the date here at the top, and then you can just enter whatever their cholesterol level was here. At our health fairs, we do only take total cholesterol. So these are the ranges of numbers that you're going to be looking at. So under 200 is desirable, 200 to 239 is borderline, and above 240 is high. So of course, if they're under 200, you can go ahead and let them know that they are in the desirable range and that their cholesterol is within normal limits at this time. Anytime that you start getting into the borderline or high ranges, we want to make sure that the patient knows that we are not diagnosing them at the health fair, and that they might want to follow up with either their physician, or we can have either a P2 and the preceptor talk to them about their range. So for the diabetes one, whenever we're going to be asking them questions, you want to make sure that you indicate if they're fasting or non-fasting, and it does give you some ranges as far as if it's been within the past 8 hours. You still want to make sure that you put the date at the top, and then you put the reading number here. There's a couple different ways that you can go as far as the reading. So you can ask them if they've previously been diagnosed with diabetes type 1 or 2. If they have, then you would stay down here within this box here. If they have been, the goals for adults with diagnosis of diabetes the ranges are going to be here. If they have not previously been diagnosed with type 1 or type 2 diabetes, then you would take a look at this box right here where it says no, goals for adults not previously diagnosed, and here are your ranges right here. And anytime that their reading is out of range, we again want to make sure that we let them know that we are not diagnosing them at this point. But if they would like to speak with our preceptor about their reading today, they're more than welcome to do so.